Welcome to the 3D Visualization Laboratory at Marian University. This video explores the vessels that supply the vascular territories of the lungs and how these become important in cardiothoracic surgery. All visual models presented in this video were generated from CT images. Here's a table summarizing the pulmonary arteries and their branches. Right now would be a good time to take a screenshot or write this down for reference throughout the video. Here's a similar table for the pulmonary veins and their tributaries. First, we will talk about the left lung. The left lung is divided into an upper and lower lobe. The arteries that supply the upper lobe are the left posterior segmental artery, the left apical segmental artery, the left anterior segmental artery, and the left lingular artery. The veins that drain the upper lobe are the left apico-posterior vein, the left anterior vein, and the left lingular vein. Now we look at the left lower lobe. The arteries that supply the left lower lobe are the left superior segmental artery, left posterior segmental artery, left anterior basal segmental artery, the left medial basal segmental artery, and the left lateral basal segmental artery. The veins that drain these areas are the left superior vein, the left superior basal vein, the left inferior basal vein, and the left anterior basal vein. And here's what the left lingular vein looks like draining the upper lobe. Now we will talk about the right lung. The right lung is divided into three lobes, an upper, middle, and lower lobe. First, we will talk about the arteries that supply the lower lobe. They are the right superior segmental artery, right posterior segmental artery, right anterior basal segmental artery, the right lateral basal segmental artery, and the right medial basal segmental artery. Now we will look at the veins that drain these areas. The right superior and right inferior basal veins. These come together and drain into the right common basal vein. You also have the right superior vein and the right anterior basal vein. Now we will look at the upper lobe. The arteries that supply the upper lobe are the right posterior segmental artery, right apical segmental artery, and the right anterior segmental artery. The veins that drain these areas include right posterior vein, right apical vein, and the right anterior vein. Now we will look at the middle lobe. The middle lobe has two arteries, the right lateral segmental artery and the right medial segmental artery. There is only one vein that drains the middle lobe, the right middle lobe vein. That concludes the first portion of this video. We will now look at how these vessels become important in cardiothoracic surgery. The two procedures we will explore in this video are a right upper lobectomy and a left pneumonectomy. The indications for performing a right upper lobectomy could include a pancreas tumor, tuberculosis, lung abscess, and emphysema. Now we will discuss how the surgeon separates the vessels and bronchus that supply the right upper lobe from the hilum of the lung. The first step in a thoracoscopic lobectomy includes identification and blunt dissection of the upper pulmonary vein at the hilum of the lung. Once identified, the surgeon will clamp the vessel and use an endoscopic stapler, which both cuts the vessel in half and then staples each side of the vessel to ensure there is no bleeding. The surgeon will then identify and use blunt dissection to find the anterior truncus of the pulmonary artery and the posterior branch of the pulmonary artery to also be cut and stapled. The process of cutting and stapling is repeated once more for the bronchus supplying the right upper lobe. Once the right upper lobe vessels and bronchus is completely separated, the surgeon will use the endoscopic stapler to cut along the anterior and posterior fissures along the inferior aspect of the upper lobe. The anterior incision separates the upper lobe from the middle lobe, and the posterior incision separates the upper lobe from the inferior lobe. Once these incisions are complete, the upper lobe is completely separate and can be removed from the intact portion of the lung. In the case of cancer, the surgeon will place the lobe in a bag and seal it prior to removal. This ensures there is no sloughing of cancer cells onto the healthy lung tissue, resulting in contamination. Next, we will discuss a pneumonectomy, or complete removal of the left lung. Indications for a pneumonectomy include malignant or benign processes, chronic infection, traumatic injury, or congenital defect. The first step in a pneumonectomy is to isolate both the inferior and superior pulmonary veins using blunt dissection. Once isolated, the pulmonary veins can be divided, cut, and then stapled using the endoscopic stapler. The next step is to isolate the left main pulmonary artery. It is important to use blunt dissection to dissect the pulmonary artery away from the left mainstem bronchus. Sometimes a catheter is used to pull the artery away from the bronchus to ease the clearing of lymphatic structures or residual pericardium. Once the artery is completely separate from the bronchus, it is cut and stapled. Lastly, the mainstem bronchus is followed up to the carina and the stapler is used to cut and staple it closed. The lung is then placed in a bag and removed. To aid in removal, the surgeon can spread apart the ribs to make room for the lung to be removed. That concludes this video on lung anatomy and its importance to cardiothoracic surgery.